Hello everybody! So this presentation is how to write multiple choice questions well. Multiple choice questions are wonderful for testing factual knowledge. One of the criticisms in the past is that they're very much based on recall of information. So this presentation is going to try and explain how to write more context-rich MCQs, which shows a little bit more application of knowledge to specific contextual situations. And so it's just pushing up the abilities required of the test candidate from simply recalling information to being able to apply that information. Now, having said that, MCQs, even though I love them, they cannot do everything. They should be used in an holistic assessment strategy with other aspects such as short note questions, portfolios, skills assessments. Again, in medicine we use a lot of skills assessments such as OSCEs, and workplace-based assessments are also used once students are, once people are qualified and now on the wards. So MCQs are not the only form of assessment that should be used in an holistic assessment strategy, but they're certainly very powerful because of the breadth of knowledge that you can assess. And certainly I think they can be written so as to assess application of knowledge instead of just assessing recall of knowledge. One question type that's used a lot now in medical circles is the single best answer, or SBA type of MCQ. Now the USMLEs, which are the national board exams over in the States, really have published the most about this type of question format. But in essence, we break it down into three main parts. This presentation will talk about the response format, in other words, how the option list is formulated, the stimulus format, how you write the question, and then just a few technical item flaws, or all those little cues or triggers that used to give MCQs a very bad name for being very guessable for test-wise students. So when I went through med school, we were still doing true-false MCQs, which meant that we were given sentences and had to say whether this was an absolutely true sentence or a false sentence. Now, life, as you know, is not necessarily always black and white. There are shades of grey, and in the case of even some rare conditions, you can find a case report from Ecuador or somewhere in the world that says, yes, this happened. You know, strange as it might sound. So it's not a very intuitive or easy question to answer, and it's also not a very easy one to write. So now in medical education we've moved over to what we call the one best answer or single best answer question. And here you give a situation or a scenario and you ask the student what is the most likely diagnosis or what is the most appropriate first-line antibiotic, and the candidate tells you for this particular situation in this particular patient, this is probably the best antibiotic to give. Again, in another country, if you just change something about the question in another country or with a different drug formulary, another antibiotic might be the more appropriate one to give. I mean, TB treatments are different in different geographical regions in the world. So you just bake some specifics into the actual question, say, in this very particular situation, what is the most appropriate first-line medication to give for this condition. So it's much more intuitive, and it's asking candidates to rank the options against each other as regards which is the most probable and which is the least probable, what is the most appropriate and what is the least appropriate. So here are some examples of the old-style true-false questions which we don't like. They had to be very carefully written. You can see that they're quite long sentences, and even in situations where they are genuinely absolutely true, you would have to write long sentences and sometimes with qualifiers to make absolutely certain that what you were writing is an absolutely true sentence. And then you get to the ones that get to be a little trickier. The cystic artery is a branch of the common hepatic which arises from the celiac trunk. Well, the common hepatic definitely comes from the celiac trunk, but we now run into problems because the cystic artery is usually from the right hepatic artery. So you're thinking, well, it's probably false, but the really smart candidates will know actually the cystic artery can come from the common hepatic. That's a known variant. So does this person who's asking this question mean, can it come from the right hepatic? Can it come from the common hepatic? Because it can. It's not the best answer. So do I pick true or false for this? So candidates who actually knew a lot about the material would just get confused as to, with this sentence, do I answer true or do I answer false? So it wasn't easy. Looking at single best answer questions, and again, this is the example I always use. Cystic artery is typically a branch from which of the following? And it's typically going to be coming from the right hepatic artery. Now, there's a lot of variance, as you can see, but yeah, typically it's going to be the right hepatic. All of the others are possible, though. It can come from the gastroduodenal, it can come from the left or the common hepatic, and yes, you can even get it coming from the superior mesenteric, believe it or not. That's example down here. So all of the others are possible and plausible, but it's absolutely defensible because you can state, well, it might come from the left hepatic in that patient that you saw in a clinic 5 years ago, but in most patients, and over 90% of people, the origin is going to be from the right hepatic artery. So this is what we don't want to see, though. We don't want somebody to say, okay, I have to write a question, and they pick one of the options. Which of these statements is true? This is a wolf in sheep's clothing. You're now asking 5 true-false statements bundled together as a supposed pick the best answer. It's not. These are all different. You are making determinations as to whether each of these are true or each are false. You can't rank them against each other. You can't say which is more probable than another. You're comparing apples and oranges, cats and dogs. This is not a single best answer question. So coming back to most likely or best answer questions, you can say, what color is the sky? All of the above may be true at some stage. You know, you can have some fabulous red sunsets. Arguably, the clouds are what are grey, not the sky. And one rock band thought a hazy shade of winter. But if you're going to ask, what is the most likely color of the sky? What would you paint it in a picture if you're painting a clear sky? The answer, I think most of us would all say the most likely option here is going to be blue. Okay, so the others are possible, you know, especially in Ireland. And so again, you can rank them all from most likely to least likely. One thing that can help you target your question to actually asking a question instead of just what is true is to use a guideline called the cover test, and that is literally to cover the options and see if it's still possible to answer the question without even seeing the options. In this second case, it is okay if you know the rules of rugby union well enough, and probably just play advantage. But in this situation here, well, there you have to see the options. Now, arguably, it is still a very targeted question, so that once you remove your hands and see the options, it's still relatively straightforward as to which is going to be the correct one. And the purpose of the cover test is really to avoid this type of question, which some people can end up writing, where if you cover the options, the world expert in this particular medication, propranolol, would not be able to answer this so-called single best answer question. It is 5 true-false statements that have been bundled together, and it's a wolf in sheep's clothing. It's 5 true-false statements, and you're only giving the poor student 1 mark for reading through 5 true-false statements and deciding which is true and which 4 are false. So the cover test is very useful for picking out flawed questions like this. Just to say that all the examples I've shown so far, most of the examples I will show will have 5 options. That is the way the NBME in North America run them. The fellowships in Ireland, the MRCSI MCQs, they're typically 5 option MCQs. COSEXA, the surgical training body for Central and Southeastern Africa, only use 4 options, and you will find some people only using 3 options. All those are fine, just so long as you bake it into your test design and allow for this in your cut score or your pass mark. You can have 3 options, 4 options, 5 options, absolutely not a problem. It's just my own house style is that we use 5 options, and that is baked into our assessment design and into the cut scores that we apply. So we have talked about the options. We use 5 options here, and all the options should be the same thing. You want to rank apples with apples. You want to say, you know, have 5 arteries. You'll have 5 different antiemetics, have 5 different antibiotics, have 5 different receptors, so that you can say of these 5 similar things, which is the best. You then want to have a focused question or lead in. The cover test will help you see if your question is focused. Have you asked a definitive question, or are you simply saying, propranolol, what's true? You know, so You want to have a nice focused question or lead-in. So now we think about how we're writing the actual stem or the vignette and how complex we want to make it. And the reason we do that is to try and make the multiple choice questions a little bit more challenging for the students. You can ask questions down here, does X come from Y? And honestly, when students are in first med, asking them some recall questions about foundational knowledge is appropriate. But with you guys, intermediate year and senior cycle, you really should be testing how they can apply their knowledge to particular contexts. Okay, they shouldn't just be parroting information back at you. They should be applying their knowledge to particular contexts and using it appropriately. So that's why we say that we write questions that are more context rich. I'll give you some basic examples, and again, they're basic examples so I can fit them on the slide, but it's to show you. So here we have a very straightforward recall-based question asking which dermatome is at the umbilicus, and the answer is going to be T10, so it's very much recall-based. This next question is also arguably recall-based. I mean, you're saying skin of the umbilicus, which segmental spinal nerve is associated with that dermatome, so it is still very recall-based. But it is it's getting the students used to reading a contextual vignette a little bit more, and they're going to have to read them later on, in much more complex ones. So it's getting them used to reading a little vignette, and arguably it's also assessment as learning, that they're learning a little bit about herpes zoster at the same time. So another example of how to write this would be to give a patient coming into the emergency room with very specific symptoms, something we call ptosis, meiosis, and anhidrosis. And you can say, well, given these symptoms that this patient is having in their head and neck, this is most likely due to damage or compression to which of the following ganglia, which is a type of structure of the central of the nervous system, and then give the 5 options. And it's going to be the stellate ganglion. There is another way to ask this, which is just, when attending an anatomy tutorial, you're asked to name the ganglion that transmits sympathetic fibers to the head and neck, which is a much more recall-based question. So again, we prefer the test of applying knowledge to a clinical scenario where we give a specific set of symptoms and say, given these symptoms, where's the damage? Now, the examples of clinical vignettes that I've put on these slides are relatively small. That's to make them fit. You'll find that some of the examples in the step 1, for any of you who did them, can be much more convoluted and complex. And so arguably there's a lot more reading time. Now, we give 90 seconds per MCQ, and we do check our exams to make certain that it doesn't look as if students are pressed for time answering these. But one argument about this is that, yes, it's a lot for people to read. So let's look at this vignette here. Okay, we've got a patient with the ulcer at the cardia of the stomach. We might then have this single vignette and have this first question. Let's apply to this areas from which of the following arteries, and give those 5 options. We might then have a second question attached to the same vignette asking about physiology related to this. And again, you would give 5 different options. I haven't put them on the slide just for space's sake. And then you might ask a pharmacology question just about 5 different treatment options. You know, the appropriate triple therapy and 4 other distractors that look relatively plausible. And so you could have a complex contextual vignette and have about 3 or 4 different questions attached to it. So there are advantages to that in reduced reading time for the students. The disadvantage is, of course, that if you only have 30 items on your multiple choice question paper and you've now given 3 of those to peptic ulcer disease, that's now 1/10 of your paper examining peptic ulcer disease, and is that 1/10 of the content of the module? So we don't tend to do this in MRCSI simply for the fact that we use our MCQs to try and cover as broad a range of information or content in the module as possible. So it is possible to do this if you have a MCQ paper with a very large number of items, but if you've only got 30 or 40 items on the paper in total, you know, having 3 out of 30 on one particular section of content, that might not be very appropriate blueprinting. It might be too much emphasis on one small part of the curricular content. So when writing a single best answer question, there are those 3 elements. You have the stem, which is going to be your clinical vignette. And again, just think about patients you've seen in the emergency department, in the outpatients, on the wards. Think about those typical or sometimes not so typical clinical presentations. What's the relevant age, gender, presenting complaint or presenting problem, any relevant history, any relevant examination findings or test results. So yeah, just think about patients that you've seen, either in the more recent or in the more distant past, as examples of clinical or contextual vignettes that you can use. And then once you've given the relevant presenting problem and relevant history, signs and symptoms, you can then say the lead-in. Which of the following is the most likely diagnosis? Which of the following is the most appropriate first-line antibiotic? And so on and so forth. And then of the options, you give 5 similar options or homogeneous options, like 5 arteries, 5 antibiotics, 5 receptors, 5 muscles, 5 nerves, whatever. And of those 5, one should be the best option and the others could be plausible. You know, it might be, you might have the second line and third line antibiotics in there, but one of them should be the best option, okay, standing out a little bit from the others, but the other 4 could be plausible. But that's how to write it: stem, lead-in and options. So now we come to those things that gave MCQs a very bad rep: technical item flaws. In other words, errors or flaws or cues written into the questions that would help students guess them, quite frankly, even if they didn't know the content. You'll find some papers will describe 17 or 18 of these flaws. You can bundle them into 6 main ones though, so we'll have a look at them in turn. So, grammatical cues. You'll see that this MCQ has a run-in sentence. All of the others that I've shown you so far have had a very clearly defined question with a question mark. And that is because these run-in sentences, you're more likely to unconsciously put errors or cues into these. So you should always write a question with a question mark. Because you can see, if you follow this sentence through, the first step in management should be IV administration of, well, I don't know how tight you can roll up an x-ray or bung one of these into a vein, but no, the only thing that you can actually administer intravenously is going to be insulin. Now you could always say, what is the most appropriate first step in management? Question mark. And that would make that a more appropriate question. But these run-in sentences, you're more likely to run into grammatical clues or put other little errors into it if you write run-in sentences. So write a clearly defined question with a question mark. You're less likely to have problems. Next example, if I can get this to advance. Yeah, okay, so here we can see that you have another run-in sentence. Every day you should eat an, well, the indefinite article here in front of a vowel is going to be an. In front of all the others, it would be a. So this is another issue with a run-in sentence. If you said, what should you eat every day in order to keep the doctor away? Question mark. You wouldn't have this cue there. So that's another issue that you would get with those run-in sentences. So rephrase and ask a clear defined question with a question mark. And again, you might find that you run into these problems with articles and also with plural and singular nouns. Which brings me to my next point on how to phrase the lead-in. So here we have another example, 58-year-old man, and I've given this example with plenty of psych people in the room over the past few years. And yeah, this is what they will describe. This is what we say is the typical layperson's description of this, and the symptom is derealization. So you will find these word repeats, you know, that we will have the same core etymology for various nouns, adjectives, verbs, and so forth in medicine. So you will find those little word cues or those word repeats sometimes cropping up. And we're so used to the vocabulary, we don't necessarily see it. So this is why it's very useful to get somebody else to read over your MCQs before you submit them, because they might pick up on these word repeats. We all have unconscious biases. We all have things that we might overlook. And so at least 2 or 3 pairs of eyes, you're more likely to pick them up. Here's an example that's a little bit more topical. Asking participants to select one choice from a list of options is, of course, the choice activity. So you can just rewrite this and hopefully then not have it so obvious to test-wise candidates with a very obvious word repeat. So you'll see here that again, yeah, it's a clearly defined question with a question mark. And I am saying blood supply to this area is from which of the following arteries? Some people hate the phrase which of the following. I like it. when it's used appropriately. If it's used as a synonym for what or which, it's fine. Because you'll see here that you've got a singular noun. This is a compound or plural noun. The short gastric arteries are a bunch or a group of arteries. So, you know, if I was to phrase this, blood supply to this area is from what artery, that cues that it must be one of these four, because this is a compound or plural noun. And you get those in English. Blood supply to this area is from which arteries? Well, now you're cueing, it must be this one. So if you phrase it stating blood supply to this area is from which of the following arteries, it allows you to mix singular, compound, plural nouns in your option list. So it helps you get you out of that grammatical issue. Now, the reason some people hate the phrase which of the following is that it was used inappropriately by some individuals, that they would say which of the following statements is correct. And as we saw in the first slides, that's true false. Okay, you're saying which of these statements is true and which four are false, and that's a true false question, a wolf in sheep's clothing. So that's why the phrase which of the following, some people don't like it. They think it automatically makes it fail the cover test. They think it automatically leads to people, or there's a greater risk that people say which of the following statements is true, having true false statements in the option list. Personally, I think that if it's used appropriately as a synonym for what or which, it gets you out of this problem with compound and plural nouns. But use it carefully and use it consciously. Now, this one is not necessarily cueing towards the correct option, or the best option, I should say, but it's helping you to knock two of them out. Because regardless of what you think of how true or false or how appropriate this question is, you can state that, yeah, these three make a subgroup, mutually exclusive, and it cannot be one of these two. You've either got to have equal distribution or overrepresentation in one class or the other. This is a subset that excludes the other two as being possible, okay? So you know D and E cannot be one of the options. It's got to be A, B, or C. And you've now increased the student's guess rate from 20% to 33%. So you don't necessarily have to let them know, or these test-wise errors don't necessarily have to show them which one is absolutely the best one to pick. It can just help increase their guess rate by showing them, well, it can't be one of these ones. So let's have a look at this one. Secondary gain is, well, now it's a run-in sentence, which we don't like anyway, and again it totally fails the cover test. The world's expert with 1,000 or 2,000 papers written on secondary gain would not be able to tell you what the correct option is here with the options covered. So we don't like it. But anyway, it's saying secondary gain is a complication of a variety of illnesses and tends to prolong many of them. And you can practically see that that probably was a true-false question that somebody just tried to put into this new format and just wrote a couple of different options around it. So be wary of having one option that looks absolutely long and lovingly crafted and well written and carefully phrased. It's more likely to be the best option or the correct option. The other thing that you're going to look out for is poor Brian. You know, if you've got a typographical error or something like that on one of the other options, again, that cues the student to the fact that nobody was proofreading those other options. Ah, it must not be important. Ah, it's probably one of the distractors and therefore I won't pick that one. So look out for that, the fact that you've got the correct or best option being carefully phrased, lovingly crafted, and very long and very carefully worded, and that you've got errors and typographic and typos and so forth in the other options. It just cues the student towards which option were the examiners and the proofreaders paying attention to, in other words, which is the most likely correct one, and which ones were they just glancing at because they're just distractors. So do have a look at all of the options carefully when you're proofreading papers or looking at questions for colleagues. Okay, here's another one. Local anaesthetics are most effective in the... Right, and again you can practically see the old true-false statement that this was originally written from. Somebody had a lovely true-false statement about local anaesthetics and realised they had to try and write these new fangled formats and just decided I'll change a word here and change a word there. Now our students are highly intelligent individuals and they can reverse engineer this. So they'll say, okay, you've got 2 cationics, 2 uncharged. I think nerves are probably got some sort of electrical impulsy thing going on, so we'll say charged. So cationic, 3 insides, 2 outsides. I wonder, could it be this? And the answer is yes, it is. And so you can pretty much see that this used to be a true-false statement, and then whoever was writing it into this new format just changed a word here and there. Students can reverse engineer that, and it's a very poor question anyway. It's purely recall, and it's horrible. So that's an example of an old true-false question that somebody just tried to reformat to single best answer format. So honestly, when you're writing single best answer format questions, you're best off not looking at true-false ones at all. Trying to rewrite true-false questions into the single best answer format does not work. The ethos of the two is entirely different. One was asking you to decide if statements are definitively true or definitively false. Others are asking you to say, in this particular situation, well, what's best? You know, the others are possible, but what's best? So trying to rewrite one as the other does not work. Here is, oh yeah, so on the face of it, this looks okay. You got, you know, a little clinical vignette, and you're saying, what extra articular feature would you not expect to see? The issue is this. If you have 30 items on the paper, and you have 28 items that are positively phrased, as in what is the most likely diagnosis, and you have 2 that are negatively phrased, what is the least likely diagnosis, or what would you not expect to see? When the students are under pressure in an assessment situation, they'll probably misread them and put down the most likely answer. So we used to have some negatively phrased ones in there, and we used to put except and not, and then we used to bold those, and then we used to bold and capitalize them, and then we used to bold and capitalize them, do everything practically apart from put them into red ink and neon and so forth on the page. But you would still find some students misreading and going for the most likely option instead of the least likely option. If you had even numbers of the 2 on the paper, it wouldn't matter. But it is harder to write a negatively phrased MCQ, a good quality negatively phrased MCQ. That might sound counterintuitive, but it is actually harder to write a high quality negatively phrased single best answer question than it is to write a standard single best answer question. So we don't do them. And again, it just confuses students. So we don't use negatively phrased questions. It's possible to write them well. And again, other institutions might use a mix of positive and negative MCQs. But the house style in MRCSI is that we do not use negative questions. We only use positively phrased questions. What's the most appropriate first line antibiotic? What is the most likely diagnosis? And so on and so forth. And again, when we come to absolutes, be careful. Yeah, you know, I'm sure the IT department love my internet searches. So absolutes. Now, this used to be more of an issue when you were writing old true-false statements, because stating that something is absolutely true or absolutely false, well, even the examiners would disagree about what that meant. I mean, this was a study done over 20 years ago at this stage, saying, well, if you're using the term never in a multiple choice question, what do you mean by never? Is this something that is absolutely honestly never seen? Or is it like a never event, that it should never happen, but there are cases that crop up? In this particular survey, one person thought that never could mean up to 5% at the time. So, looking at positive, always, something always happens. Is that 100% or is that 99%, but you can get exceptions, 95%? Yeah, there can be a few more exceptions, or only 80%, always. 80%, 20%, yeah, it's, so this is examiners deciding on these frequency terms, let alone the poor candidates trying to guess what the examiners mean by these absolute terms. So this was another issue with the true-false questions. This is why people ended up being very careful about the way they phrase them and putting lots of qualifiers in them. And again, the poor candidates had to guess what the terms meant, or what the examiners meant by those terms. And this is the discrepancy in opinion as regards to what should be 2 absolute terms, always and never. If you look at the other frequency terms, it's even worse. You know, people thought associated with could mean anything from 30% of the time to 100% of the time. Often could mean anything from 20% of the time to 90% of the time. So the poor candidates with these true-false statements trying to figure out, you know, if you've got a true-false statement with the phrase probably, what do they mean by probably? So this is why true-false statements were very difficult to answer at times. But now we're very good at ranking them. You'll see that the ranking of these is relatively consistent though. And so humans are relatively good at ranking things once they're given a series of options to choose between. So this is why we do single best answer. We give them 5 options and say, of these, which of these is the best one? Okay, so we're generally pretty good at ranking things, comparing them to each other. So that's why we use the single best answer questions instead of all of these true-false statements with all of these qualifiers and frequency terms. So some useful principles. The shape of the question, you want all the reading to be in the vignette. So it can be a long, complex vignette with relevant medical history, presenting problem, medications, test results, clinical signs and symptoms, whatever. You choose how much or how little you put in there. But yes, most of the reading should be in that, and then you have a clearly defined question, the lead-in, and the options should be short. You'll see in a lot of the examples I've given, some of those options are, in the case of the dermatomes, they were just 3 characters long. You know, in the case of the arteries, it's just like 2 words in some of those options. So you should be aiming to keep those options really, really short, 1, 2, 3 words in them. All of the reading, all of the shape, the length is in the actual contextual clinical vignette. Cover test is an excellent guideline. Ideally, you can guess the best option or potential options before seeing the option list. And this really just helps you see, have you asked a clearly defined question instead of just saying, propranolol, what's true? Use homogeneous distractors, we've said this already, all arteries, all medications, all diagnoses. You cannot rank dogs and boats. They should all be the same type of thing. Grammatical consistency, we've discussed that already. They should be logically compatible and put them in alphabetical or logical order. That's, again, if we have our way and if we have our choice about where to, if we can choose the order ourselves, honestly what we tend to do is that we'll often have the correct one nicely huddled in the middle as option C. Edge aversion is a real thing. People often don't like writing MCQs with the correct option in position A or position E. And so this is why we say alphabetical order, because hopefully if we have things in alphabetical order, we will have a relatively random distribution across the paper of where all of these options are going to be. That will have a fifth of the questions with option A, a fifth of the questions with option B being correct, and so on and so forth. If you are doing this in a computer-based system like Speedwell, which can randomize the option number, it doesn't matter. Don't use vague frequency terms. I've shown you those previous papers that show that examiners can't decide what they mean. The poor candidates trying to mind read the examiners really don't have a hope. Never use absolutes, okay, because again we can't agree on those, and do not write a negative question. Again, that's a more house style thing, that we don't write negative questions, we write them all positively phrased. Final considerations for candidates. If you don't know, honestly choose C, because as I've said, we tend to have this bias as humans to put things into the middle, carefully clustered, and have edge aversion. So be conscious of that and avoid it in yourself. Make sure that you do have MCQs where the single best answer is option A or option E. The longest option is often the correct one. That's because people spend longer phrasing it, writing it, carefully tailoring it. And yeah, if there's a spelling mistake, that means very few people are looking at it or proofreading it. It's more likely to be a distractor. So be aware of these unconscious biases and avoid them when you're writing your own MCQs or proofreading other people's MCQs. For authors, follow the style guide if it exists. Again, here in MRCSI, 2 house style things would be that we use 5 options. Other people might use 4 or 3, but here in MRCSI we use 5. Again, we don't write negatively phrased questions. So be aware of specifics in the institution in which you're working when you're writing MCQs. Do see if there's a style guide or any in-house rules. Provide normal value ranges. Different labs and different hospitals will have slightly different calibrations. And for us, I mean, we have students that we teach and assess in Ireland, in Bahrain, and over in Perdana in Malaysia. So do provide normal value ranges, because different institutions and different countries might be using different units. Be careful with acronyms and drug names. So use generic drug names if the trade name is more widely known, then by all means put that in brackets. But the generic should be in there. The trade name is an optional. Is language a factor? Well, it is for our students. We have students, as I've said, here in Dublin and in Bahrain and over in Malaysia. So things like accident and emergency, or A&E. Yeah, emergency department is a better phrase to use. People on all campuses do understand that one. Another one is GP. Again, we understand that term in the UK and Ireland. That's an MMO in Malaysia. Okay, they use a different term. As well as that, in Malaysia, they don't use the verb admitted. When they're admitting patients, they are warding patients. So beware of those different synonyms if you can. Ask around. For example, if you use the phrase, a patient was admitted to the ward, the Malaysians will understand that because it's got the word ward in there, and that's the verb they use to ward a patient. To admit them to the ward would be what we'd say. So yeah, language can be a factor. Just to be aware of that and not to use complex phrases, complex subclauses, inverted subclauses and things like that. Just to be careful that you're using clear English. It can be applied English, it can be medically relevant English, but try not to make it too grammatically complex or convoluted, because then what you're doing is you're giving them an English language test instead of actually assessing their medical knowledge. And so we want to reduce what's called construct irrelevant variance, in other words, things that have nothing to do with medical knowledge. So one or two other issues. What about adding images to MCQs? Well, there is a large amount of research that's been performed looking at multimedia learning and at the use of images and other resources in teaching and in retention of information. But there's very little evidence as yet with regards to assessment. So from what we do know, and again, there really is not much published on this so far. What we do know is that there doesn't seem to be a consistent influence on item statistics such as item difficulty or discrimination. So the basic guidelines for this that we can give you is just to include the images or not based on constructive alignment. What are the learning outcomes that the student is supposed to achieve? Are they supposed to be identifying things? Are they supposed to be describing things? So have a look at the learning outcomes and use the images or not in the question as regards constructive alignment. I would say do not repeat information in the text that is there in the image. There shouldn't be any redundant text. Again, you want to split the information coming in between the visual and the verbal channels. You don't want to have the visual information duplicated in textual format. That's just overloading. There's no point in doing that. So, you know, if the image is just there as a pretty picture, don't include it. If the image is absolutely necessary in order to answer the question, then absolutely include it. Something else that we consider in MRCSI, given that we have large numbers of students coming from abroad, is exactly how do we phrase these multiple choice questions. This is not an English language exam. They've already done their IELTS and got very good scores. So we are now trying to assess their medical capabilities. And yes, there is going to be some construct relevant language or technical vocabulary that they need to learn as they go through medical school, but we shouldn't make things too hard for them. For example, having long noun phrases or having very complex statements with dependent conditionals, or having inverted subclauses, or like left branching sentences. Other things like use active voice verbs, present tense if possible. It just makes that bit of the language simpler. So it reduces construct irrelevant variance and means that what you're examining is the medical or the anatomical or the technical knowledge and vocabulary that they need to learn. And that is going to be a judgment call as to what linguistic aspects are relevant and they should be able to understand and converse with regards to the technical language of the specialty they're going into, and what is irrelevant. I mean, do we really need to go into subjunctives? And this also brings us back to should you ask negative questions as MCQs or not? Well, here things differ. In the undergraduate and MRCSI, we don't ask negative questions because students often misread them under the stress of assessments. For the postgraduate assessments, negative questions can be asked with care, but they're not encouraged. And certainly once you start putting double negatives in there, that gets confusing. I mean, in English, a double negative is back to a positive. In Russian, and I think in Spanish and some other languages, two negatives are still a negative. So you have to consider that different languages will differ in their interpretations and colloquialisms. But yes, MCQs are still used. The huge advantage of them is 60 seconds or 90 seconds per item. You can test such a breadth of material with this, and then with the other assessments that you use, short note questions, portfolios, you can choose to go in deeper in targeted areas just to ensure that there is depth in areas too. For skills-based assessments, certainly in medicine we use OSCEs and other skills-based assessments like that. So it is not the only assessment construct. It absolutely cannot do everything, but it is very useful for testing the cognitive domain and testing the breadth of the cognitive domain to help you have a widespread blueprint. So thank you for the opportunity for telling you a little bit about multiple choice questions, and here is just a list of references I hope might be of some use.